Are you pregnant? Are you interested in learning more about exercise during pregnancy? Stick around. I'll discuss the latest recommendations today coming up. Hey everyone, Dr. Wes Davis. I make weekly YouTube videos giving you the best evidence-based information to help you have the best possible outcome for you and your baby. So if you're new here, please consider subscribing. So we all know that exercise in general is a good thing, but what about during pregnancy? There's plenty of evidence that exercise during pregnancy has many documented benefits and no substantial risks for an otherwise low-risk pregnancy. So let's talk about some of the documented benefits first. There's evidence that regular exercise during pregnancy can help you gain a healthy amount of weight during the pregnancy, and that reduces the risk of excessively grown babies, or what we call large for gestational age babies, by up to 50%, and that may contribute to a lower C-section risk. There's also evidence of possible reduction in the risk of gestational diabetes and preeclampsia. Also, reduced back pain and musculoskeletal pelvic girdle pain has been documented. Some studies even show a reduced time during labor. And lastly, regular exercise helps you get off the baby weight after delivery. So what type of activities should you avoid? It's recommended that you not do things like hot yoga or hot Pilates, as these type of activities may increase your core temperature, and that might be associated with an increased risk of neural tube defects. Also, activities that have a high risk of either falling or direct contact. These type of activities could put you at increased risk for placental abruption and even pregnancy loss. It's also important to know that during pregnancy, the ligaments around your joints become more lax and flexible. Activities that involve quick cutting and directional changes may put you at increased risk for joint injury. We recommend avoiding the supine position, laying flat on your back, after the first trimester, as this has been associated with lowered blood pressure and possible reduced perfusion to the placenta. Avoid scuba diving due to decompression issues, and we also recommend avoid exercise above about 6,000 feet just due to the relative lack of oxygen at that altitude. So what about the risks? There's no proven increased risk of preterm birth or pregnancy loss in an otherwise low-risk pregnancy. So who should not exercise during pregnancy? Well, I'd recommend anybody who is at high risk for preterm birth, say someone who has a cervical cerclage or ruptured membranes or placenta previa. Those types of situations are possibly exacerbated by physical activity, and so in those cases I'd recommend don't exercise. Anyone who's being treated or followed for preeclampsia should avoid physical activity, and anyone with severe heart or lung disease. So what should be your goal when you're exercising during pregnancy? 30 minutes a day, 5 days a week is a great goal. Now, if you're not there yet, then I'd recommend just work your way up gradually. Maybe start with 5 minutes a day and increase that by 5 minutes a day per week till you get to 30 minutes a day. More exercise is fine, and if you're already doing more than that, keep going. I'm not saying reduce to 30 minutes a day, but that's a good goal if you haven't been doing much already. Now, the intensity is best based on individual person's tolerance and their fitness level. There's really no magic heart rate you need to stay below or avoid. It's really more about your own personal fitness and comfort level. Moderate cardio is really a good goal. Other recommendations, a good supporting sports bra and maybe a belly band would both go a long way to reducing some of the discomfort associated with exercise during pregnancy. Make sure you stay well hydrated and well ventilated so you don't get overheated and you don't get dehydrated. Warning signs would include things like regular contractions, vaginal bleeding, chest pain, shortness of breath. If you experience any of these, stop exercising right away and contact your doctor. So in summary, exercise during pregnancy is definitely a good thing with many benefits and really no risk for an otherwise low-risk pregnancy. Stay well hydrated, stay ventilated, listen to your body. A good sports bra and a belly band will go a long way to helping it be a less uncomfortable activity. If you're new to exercise, work your way up gradually. And if you have any of the warning signs I mentioned, stop right away and contact your doctor. If you have questions, please feel free to put them in the comments. And as always, thanks for watching and have a great day.